Good evening, all of you. Thank you, Ashwajit. You told a whole string of truths when you stated all the facts that we are facing today. If you circle around basically to say what has happened in first wave, second wave, and what do we expect in the future, the most significant part that happened between the first and the second wave, which should not have reached this peak that it did, and with the speed and ferocity that it did, is because of the fact we actually invited the second wave. We helped it along to go to the height that it went. And if we repeat that behavior again, then God help us. So we did not leave any stone unturned, including all the religious events and the social events and the political events, that they all coalesced into a massive mistake. So, one, like you've said already, that people suffered as they went along. In between, people have not gotten better even. And if there were any misconceptions about the severity of the disease and what it does to your body, and for the length of time it does to your body, the second wave has actually given us a shocker to say there are people who for 5-6 months have still not recovered. So now the question is, well, how do we take it into our own mind or brain or DNA to say, what have we learned and what are we going to do to prepare or to deal with the third wave? So these different aspects are very clear. One is, of course, personal behavior. That personal behavior definitely will be the key. In addition to that will be the way vaccine is rolled out. If you look at the modulations, it is clear that if we can start by the 1st of July, start vaccinating upwards of 50 lakh people a day, we can blunt the third wave by 20-25%. If we can reach the target of by mid-July to 70 lakhs per day plus, we can flatten the wave less than 50%. And if we can by some chance by the end of July reach 1 lakh a day, we may actually flatten the wave. So that's the contribution of vaccine in two ways. One, of course, we are saying that it gives you the protection. The second, as you know, that there are upwards of 30,000 variants roaming around today. And the variants, the way the virologists explain it is that the variants mutate as they multiply inside the body. So the theory behind it is that if you limit the number of bodies that get infected, and vaccine seems to be effective in actually preventing infections up to upwards of 80%, then that 10-15% who get infected and get infected in a mild manner, they do not give the virus enough opportunity to multiply rapidly. And the fact that every time it multiplies, there is a possibility of a mutation, that process can be stymied over a period of time. That's the theory. The virology theory right now is to say, if we are going to vaccinate enough people, we may be able to overcome the third wave and have a smoother road ahead as we go forward. So that's the lay of the land as far as number of people get natural infection, develop enough resistance or antibodies, or the ones that are vaccine mediated and develop the immunity, that if we put them together and enough bodies are vaccinated or immune, then we may be able to get a better outcome in the times to come. So we are estimating 6 months, you're not going to be able to change your social behavior. Those three things that we talk about have to be continued with even more intensity today than we did between the first and second wave. The second fact that has emerged very clearly is the mortality in younger people below the age of 50 is double that of the first wave. So that means the severity of the disease that affected the younger age group is much higher than what got wrote before. Coming down to my own field. So if you look at it, the whole mystery was unraveled by the 50 autopsies done by the doctors in Bergamo, Italy, who actually demonstrated that it was a three-phase phenomenon. The fact that the viral multiplies and does damage to the body is only one part of the problem. The cytokine response or immune response of the body is the second problem, and the degree with which it actually appears in the body is responsible for most of the damage. Because yes, virus we knew always will affect the lungs, but they found the virus in the kidneys, in the liver, in the heart, brain, everywhere. So that whole myth was gone that it only affects the lungs. So coming down to the heart, they also noticed that three types of things happened. One, of course, the fact that inflammation caused the capillaries to thrombose and create massive heart attacks. Second, that the muscle itself was inflamed, that you could see, and we even till today on MRIs and echoes, we can demonstrate how the inflammation in the myocardial fibrils has happened and how it is just sustained over a long period of time. The third thing was that it definitely does affect the electrical system of the heart. The entire system gets affected in many, many people. So the outcome of that is that many people with the mildest of infections will have tachycardia or bradycardia or irregular heartbeats for many months. So we are seeing it 3-4 months, we are still seeing people coming with tachycardia. So that, and if you look at their cardiograms, you can actually demonstrate the changes. The second thing is that their myocardial function comes down. From normal, suddenly it can drop to 20-25% and people die. We've seen many young people go away because of that. And the third is the fact that in the electrical system, the arrhythmias that it can cause has killed many people because of that too. So basically, it's a pan-inflammation of the body. We have designed a complete program, Road to Recovery for long COVID. So we will do the appropriate tests as we go along, including intensive cardiac, pulmonary tests, and any other abnormality that they may have been produced. And also be very careful that you should look for secondary infections, which are very important because we say the people have got negative with COVID, their chest X-ray, their CTs are looking better, but then you will see them coming with pneumonias because of the fact that we let them loose. So we have to warn the patients that any change in symptoms when they go home requires immediate attention because you should not let any of the secondary problems that may occur actually carry on and threaten your life. So basically, that's the lay of the land that I know. And I know we have most knowledgeable people on the screen here, and they will add much more than I can add right now. But any specific questions, I'll be happy to answer.
Thank you. That was very enlightening. Just a quick follow-up before we open it. Of course, we'll have the general questions at the end. People already typing in. One is, how prepared would you say the government and the private sector is for wave 3? Because I think by now we are more or less everybody's quite sure that there would probably be a wave 3. So how prepared are we? What are the challenges there? And then again, specific to your field, a lot of people fear that they could be clotting, there could be, fluctuations of blood pressure. There are questions I've got from people who said that we used to have high blood pressure before COVID. Now after COVID, we've got low blood pressure, chances of a stroke. How severe are those for a heart patient? And especially also the fact that they can't exercise. So
I said, basically, it starts with the inflammation that we talked about. If you are an already existing cardiac patient, the chances of precipitating a heart attack because of increased coagulability of your blood can, of course, precipitate heart attacks. And we have seen many, many of those. And then the ones who come in time, you take them to the cath lab, you will see over pre-existing disease that there are acute clots formed. You can actually save those people and save their heart attacks if they get on time. The second thing is that if you were to say, how do I, important part, I'm telling you what our observation is, that people who are used to exercising, if they have gone back into their exercising pattern too soon, and it's a relative term, too soon, they have suffered hugely. Every once in a while you'll hear, but we hear all the time, that 45-year-old, 50-year-old boy, people who just went, just recently we lost a friend, he was bicycling. I mean, he had COVID a few months ago, but then again, the diagnosis was arrhythmia. So the point is that you can get, if you have stents, you have to be careful. If you have had previous myocardial heart attacks, you have to be extremely careful. You'll see reverse very often, that if you don't have any high blood pressure, that you develop high blood pressure, and it will last you several months. And then, of course, the mucormycosis is always hanging over the head, and that is another big problem. So there are many, many side effects, and like I said, how prepared we are to answer your question. Look, we thought after the first wave, we were very ready. We had all the knowledge, we thought, we had all the stuff. But every day new things happen, and the ferocity and the velocity with which this second wave came, nobody expected. So we were caught off guard. Especially it was then, first it was beds, then it was oxygen, then it was intensive care units, because a lot of them got so sick that they went to ICUs. And then we have, on top of that, now we have mucormycosis. The only game changer that is so far looking very good is the fact that if somebody, God forbid, gets the infection today, you test RT-PCR positive, the monoclonal antibody cocktail, which consists of 2 antibodies, has been found to be very effective in reducing extremely effectively the viral load. Consequently, most of the people will not have to go to the hospital. And it's just last night another study came out which also showed that it reduces the death in these people who are the vulnerable people by 70%. So that may be the new weapon that we have, in addition to what we are looking forward to vaccine as a more permanent solution. But antibodies, so far, all the studies done, including our own at Medanta, we are inoculating or administering the antibodies to anybody who has, within the first 7 days of getting the symptoms, or as soon as after the RT-PCR comes positive. You can have this as in the back of your mind, that if it is given, it may save that person a huge amount of misery by hopefully 90% will never need to go to the hospital, and the 10% who go, 70% of them will get better and survive.
Thank you so much. I think that was very enlightening.